We're talking about sinus infections. There's the acute, there's the short term, the one that we get where the sinuses are blocked and you're miserable. And we want to try and treat that without antibiotics. If you go a week or 5 days or 10 days without an antibiotic and you're still having symptoms, you need to call your doctor, probably need a course of antibiotics to get you well. If it doesn't get well in the last 12 weeks, that means it's called
chronic rhinosinusitis.
So why do you say rhinosinusitis?
It's just more inclusive of infection and inflammation in the nose and the sinus cavities, which function together.
So when they function together, if you've got rhinosinusitis, what do you have to do about those drainage areas that are closed? What's the treatment for chronic sinus infection?
It's to open those drainage areas, and so we've begun discussion about balloons to dilate the area, and the openings have little bony shells in the area where we dilate, and so it's not like where we used to stretch a heart vessel and it was all elastic tissue and could collapse back down. Now if we dilate those areas, there's actually bony remodeling in the sinus opening, and so they stay open. It's a tool. It's used in certain sinuses, predominantly the maxillary, frontal, and sphenoids, but not the ethmoids. The ethmoids are unique and are often the seat of chronic infection in people. They're a honeycomb space, and in those little honeycombed air cells, infection can set in. And the blood supply to those areas is not great, and you can treat and may feel better, but you may leave a little seed of infection from which your next sinus infection reblossoms. And so there can be a staccato pattern of infection better, and these people that have chronic sinusitis who are getting antibiotic therapy over and over again. If we can open them, we can eliminate that. And if it's simple and it's isolated infection in the maxillaries, then a balloon might be a great office-based procedure.
That balloon is called sinuplasty.
Balloon sinuplasty, yeah.
And that's where you open it up. And we've had a show on that. I want people to refer to that because that can be done in the office, frequently done in the office, opens up the hole, lets the sinuses drain. Next step?
Next step would be moving towards a more traditional endoscopic sinus operation, where, especially in those people that have ethmoid disease, really if you have ethmoid inflammation or infection that we see on the CT scan x-ray before surgery, which is the roadmap for our surgery, then you're going to require a more traditional operation. I will say we're doing more and more of the ethmoid work in the office now, but typically that's done in the operating room. And so you're basically opening up those little honeycombed air cells so that they can drain, and it improves plumbing. And that's part of the story towards health. The other one is medical management after sinus operation, because something caused inflammation in the nose that led you to get a chronic infection. And it's not just the anatomy or obstruction, it's a combination of the person's immune system and how it responds to challenge. It's allergy, it's irritation, it's obstruction, it's seated infection. And so you really have to take a whole look at all those things to be able to determine how am I going to get that person better.